Hi there. Welcome to the HealthAnalyticInsights podcast. This podcast is all about creating a community of like-minded individuals who are passionate about the field of health analytics. I hope to share information and advice in topics such as health informatics, digital health, biomedical engineering, and data visualization in healthcare. And in exchange, I would love to hear from you, dear listener, about your experience and interest in this field. You can drop me a line at healthanalyticinsights@gmail.com, and this email, along with any references discussed during this podcast episode, will be listed below in the show notes. If this resonates with you, don't forget to follow and subscribe to this podcast, as I'll be uploading and trying my best to remain consistent with new episodes coming out bi-weekly. If what I'm discussing in this episode resonates with you, don't forget to follow and subscribe to this podcast, as I'll be uploading and trying my best to remain consistent with new episodes coming out bi-weekly. Without further ado, let's get into it. On this episode of the Health Analytics Insight podcast, I would like to dive into some key questions you might ask yourself before building and designing a clinical dashboard. So what even are clinical dashboards? Clinical dashboards can be described as a visualization tool to house healthcare data. They can include both quantitative and qualitative information, and they can be static or interactive. An effectively designed dashboard should be able to answer a question a user has without too much frustration on the end of the user, or for the continuous need for the user to seek external guidance from IT or the business intelligence teams to be able to navigate through the dashboard and find their answers. Because if this happens consistently, the end user might become frustrated and stop using the tool altogether. Dashboards should support users in their day-to-day jobs and not become a hindrance. It requires clinical buy-in if you're moving towards a data-driven health organization. Clinical dashboards could report key metrics such as ER wait times, patient satisfaction, and average length of stay. These are just some examples of metrics that you could find on clinical dashboards. One interesting use cases of clinical dashboards I read about was a clinical dashboard that was built using Power BI used at the Phoenix Children's Hospital to help resume a backlog of over 3,000 surgical procedures. This backlog was a result of COVID-19, where the governor of Arizona paused elective surgeries to prepare for future patient hospitalization. Of course, this resulted in a unique case where technology could be used to drive and improve patient outcomes. Instead of having a disorganized system of, a bunch of emails, paper notes, and other files, the dashboard could present necessary centralized information where clinical staff can easily navigate and plan their schedule on a day-to-day basis by just looking at the dashboard and finding the answers they require, instead of having to dig through emails and notes. Specifically, the creation of the dashboard allowed surgeons to review cases and assign priority of high, medium, or low to backlogged and new cases. Dr. Vaidya, Chief Medical Information Officer at Phoenix Children's Hospital, stated about the dashboard that the technology allowed for synergies across the enterprise in addressing the multifaceted challenges of resuming these operations. So here we see a prime example of how health analytics, specifically a clinical dashboard, can make a significant difference in improving hospital operations and bringing different departments within the organization together. And this really cool example segues nicely into what are the key benefits of building a clinical dashboard. And research on the impact of clinical dashboards show strong correlations with improving patient outcomes. There have been some recorded instances where dashboards seem to have a direct effect on improved patient outcomes. For instance, one study done by the Stanford Pediatric Intensive Care Unit sought to increase compliance with central venous catheter insertion through the implementation of a checklist. And the team created a dashboard and found that this dashboard contributed to decreased infection rates. Another example in Ontario with the Markham Stouffville Hospital had a significant reduction in emergency department patient length of stay metrics with the help of clinical dashboards. So one caveat to make clear is, in my research on the importance of clinical dashboards, it was quite clear that clinical dashboards were not the sole force driving behind this improvement in patient outcomes, but it was a part of the whole when it comes to improving patient outcomes if the dashboards are designed effectively and with the healthcare professional in mind. And this is really important. You can't just spend all this time designing a dashboard, put it in your organization, and cross your fingers and hope for the best. You really need buy-in from clinicians using the dashboard, and they need to have a say in the metrics right from the designing stages, so you don't waste your time and people are actually using the dashboard to drive change. You really have to be open to their feedback and criticisms of the dashboard for there to be buy-in and a significant improvement in organizational metrics. So I say all that is, when you're really starting to design these dashboards, what are some questions that you need to keep in mind so you don't end up wasting your time on a product that is not going to actually be used? So as I have been alluding to throughout this episode, one question you might ask yourself is, how will this dashboard drive organizational change? So instead of just a hodgepodge of key performance indicators placed on your dashboard, which no one is really looking at, you want to make sure that these metrics improve patient outcome or drive organizational changes. It's important to take a step back even before you start building your clinical dashboard in whatever tool you're using, whether it be Power BI, Tableau, Click, etc. The tool is not really important. It's taking a step back to the basics, using paper and a pen, and just mapping out exactly what you want your metrics to show, why they're important, how they will be used, and really getting down to the foundation of this dashboard. It's important to take a step back and make sure that your metrics that you're putting on these dashboard and the case studies as to why you're putting on these dashboards would benefit from A, continued monitoring, and B, would support the needs of clinicians. For instance, one paper examined the potential role of dashboard use and navigation in reducing medical errors of an electronic health record system. In this paper, they focused on building a dashboard that was centered on reducing medical errors stemming from patient handoffs between clinicians. And in this paper, they stated, handoffs are a complex procedure requiring the integration of a large body of information about each patient. Imprecisions and errors during handoffs can potentially put the patient's safety at risk. And in this specific example, we can really see how this case study would benefit from A, continued monitoring, because it is an event that is happening with continuous frequency, and B, would be of benefit to the clinician's job because it would help them directly to reduce potential errors that might occur. So this study showed the dashboard was used more frequently when nurses received a specific call about a patient's chart biopsy and used the dashboard to get quick insights from the electronic health record system. So here it helped to reduce the amount of time nurses might be looking for patient information within the electronic health record system by just having a centralized system where they can easily look for their answers. So you can see the benefit of this dashboard to monitor metrics to help reduce medical errors and improve patient outcomes. So again, before building a dashboard, it's really key to understand what problem it will track and how it will support clinicians, and therefore how it will drive impactful change. And the second question you really want to analyze before building the dashboard is who owns the dashboard and who will maintain it. So dashboard maintenance is a large part of the picture. You might ask yourself questions such as, how often will the data be refreshed? Who will have access to the dashboard? Will it be certain groups of clinicians, in the orthopedic department, or will it be a publicly available resource for everyone within the hospital? Will it be refreshed daily, weekly, or monthly? And is there a proper procedure in place to report data quality issues with the dashboard? For example, if there are incorrectly formatted dates or missing values that appear. Processes are often changing rapidly within healthcare organizations, and dashboard metrics might need to be updated or refreshed quarterly or yearly. So in summary, ensuring that the dashboard that is designed has a specific purpose within the organization and is supporting clinicians is key for the adoption of clinical dashboards as an efficient and analytical tool within healthcare organizations. The Health Analytic Insights podcast is going to be focused on building a community of students and professionals who are interested and have experience in the field of health analytics so we can grow and learn from each other. Again, you can reach me at healthanalyticinsights@gmail.com and send me an email if you have a topic you would like me to discuss, or if you're interested in being a guest on the show. Please follow this podcast if you're interested in seeing more of this content, and have a wonderful day.